We're going to start by talking about what is the transplant waitlist. The transplant waitlist is a national list that after you are approved as a candidate by your transplant center will put you on the list. So the first step in getting to a transplant is to go to one or maybe more transplant centers and go through what's called an evaluation. It's usually a long visit with multiple people. And at that visit, they're going to determine if you're going to be a good candidate, and then they will list you. The list is maintained by UNOS, the United Network for Organ Sharing, and they manage all the lists of people in the United States waiting for a transplant from a deceased donor. Once you're listed on UNOS, sometimes even before you get listed on UNOS, if you have a living kidney donor, once you're an okay recipient, then the living donor gets worked up to see if they're an appropriate candidate to donate a kidney to you. And that might take you off the wait list much sooner with a much better kidney. So I tell everyone, if you can get a living donor kidney, by all means, go for it. So what is the transplant waiting list? Placement on the waiting list, remember, is not automatic. You must work with a transplant center to complete an evaluation to be placed on the waiting list, right? The waiting list is a national list, but just because you have kidney disease, nobody knows that you have it. So you can't get on a list without first being evaluated at a transplant center. So what happens after your evaluation? Sometimes a person may not be considered healthy enough either right now or maybe not have much chance for improvement. And sometimes people are not healthy enough now but has a chance to get healthier or better. So at the evaluation, you may be told that you need to lose weight, that you may need to quit smoking, that there may be an infection that needs to clear a little more, or you may need additional treatments for infections you may not have known you had, or dental work, or some other testing to figure out if you're truly healthy enough to get a transplant. In some centers, while you're going through this other testing, you may be listed as inactive. In other centers, you may not be listed at all while you're waiting for this workup to be completed. If someone tells you that you're listed inactive, that means that you're on the list and you're gaining waiting time, so you're moving up the list while you take care of the other health issues. You just, while you're inactive, wouldn't get a phone call for a kidney transplant until you're finally considered healthy enough. If you're already on dialysis, it doesn't really matter if you're listed as healthy enough or inactive at all, because your start time and your waiting time will always be calculated to backdate to when you started dialysis. Anytime you have questions about your status on the list, are you active, are you inactive, are you near the top, are you not, feel free to call your transplant team at your transplant center.